Have you ever felt a tingling or numb sensation in your feet? It can be strange. One moment, everything feels normal, and the next, it's like your feet have fallen asleep. But what causes that tingling or numb feeling? Stick around to know the answer. The human foot, sensitive and complex. Each of your feet contains more than 7,000 nerve endings, making them one of the most nerve-dense parts of your body. These nerves are constantly at work, sending signals back and forth between your feet and your brain. This communication allows you to feel different sensations such as warmth when you step on a heated surface, pain when you accidentally stub your toe, or pressure when you walk across uneven ground. The nerves also help your body maintain balance and coordination, which is why even a slight problem in your feet can make you feel unsteady or off balance. Because the feet are so rich in nerves, even small issues can cause noticeable changes. For example, if you sit in one position for too long and your legs press on the nerves, you may feel a tingling or pins and needles sensation in your feet. Wearing shoes that are too tight can compress nerves and reduce blood flow, leading to numbness or burning sensations. People with diabetes often experience nerve damage in the feet called diabetic neuropathy, which can result in a constant numb or tingling feeling. Even back problems, like a herniated disc pressing on the sciatic nerve, can cause numbness to travel all the way down to your toes. This high level of sensitivity means that your feet can serve as early warning signs for a range of health conditions. And now that we understand how complex and reactive the feet are, let's explore what actually causes that numb or tingling feeling in the first place. What causes that numb feeling? That pins and needles sensation in your feet may seem harmless at first, but when it lingers or returns frequently, it could be a sign of something more serious. While it's common after staying in one position too long, persistent numbness warrants closer attention. One common cause is nerve damage, often linked to conditions like diabetes. Over time, high blood sugar can damage nerve fibers in your feet, leading to a tingling or reduced sensation. This type of damage develops slowly, often going unnoticed until it worsens. Physical injuries such as twisted ankles or broken bones can also harm nerves and disrupt sensation. Poor circulation is another culprit. If blood flow to your feet is limited, the tissues and nerves don't get enough oxygen and nutrients, causing numbness, coldness, or heaviness. Conditions like peripheral artery disease, PAD, and heart disease, as well as prolonged inactivity, can all restrict blood flow and lead to these symptoms. Issues with the spine can also trigger foot numbness. A pinched or irritated nerve in your lower back, as seen in sciatica or herniated discs, can send numbness and tingling down your leg and into your feet. Vitamin deficiencies, especially B12, B1, and B6, can interfere with nerve function, often leading to gradual numbness in both feet. Vegetarians, older adults, and those with absorption issues are more susceptible to these deficiencies. Lastly, toxins and substances like alcohol can poison nerves over time, while certain medications like chemotherapy drugs can have side effects that damage nerve endings. In some cases, autoimmune disorders may cause the immune system to attack the nerves, leading to inflammation and numbness. How to spot numbness in your feet? Numbness in the feet isn't always as simple as not being able to feel touch or pressure. In fact, it can show up in a variety of unusual and sometimes confusing ways. Some people describe it as a tingling or crawling sensation, almost like tiny insects are moving under their skin. Others may feel a burning sensation or the opposite, an odd coldness, even when their feet are warm to the touch. These strange feelings can come and go or linger for long periods. Sometimes, numbness also comes with a sense of weakness. You might find it harder to lift your foot, spread your toes, or walk with your usual balance. It can also feel like you're wearing socks or shoes even when your feet are bare, a sensation often described as phantom padding. This disconnected feeling may make it harder to judge where your feet are stepping, increasing the risk of falls or stumbles. If you notice that these sensations happen frequently, last longer than a few minutes, or seem to be getting worse over time, it's important not to ignore them. These could be early warning signs of nerve damage or circulation problems that need medical attention. Persistent or worsening numbness is your body's way of signaling that something deeper might be going on, and catching it early can make all the difference in treatment and recovery. When to seek medical help. It's normal to feel a bit of tingling in your feet after sitting in one position for too long, especially if you've been cross-legged or in a tight space. In those cases, the sensation usually fades once you move around. But if the numbness sticks around for more than a few minutes, happens often, or seems to come out of nowhere, it's time to pay closer attention. You should consider seeing a doctor if the numbness in your feet starts interfering with your daily life, like making it hard to walk, balance, or feel the ground beneath you. If it's accompanied by weakness, sharp or burning pain, or a frequent sense of clumsiness, these could be signs of nerve damage or a circulation issue that needs medical evaluation. It's especially important to seek help if you already have a condition that affects your nerves, such as diabetes, multiple sclerosis, or a history of spinal problems. In those cases, numbness may signal that the condition is progressing or not well managed. Getting medical advice early can help prevent complications down the road, such as foot injuries you don't notice due to reduced feeling or worsening nerve damage that becomes harder to treat. When in doubt, it's always safer to check in with a healthcare provider. How to treat foot numbness. treatment for foot numbness largely depends on what's causing the sensation. Since there are many potential underlying issues from poor circulation to nerve damage, the right approach will vary from person to person. In general, improving circulation is one of the first steps. Simple activities like regular exercise, elevating your feet to improve blood flow, or quitting smoking can make a big difference. Smoking, for example, damages blood vessels, restricting circulation to the extremities, which can lead to numbness. If your numbness is due to nerve compression, as with sciatica or certain back problems, physical therapy can be highly effective. A physical therapist can guide you through exercises that relieve pressure on the affected nerves, helping to restore mobility and reduce discomfort over time. These exercises can also help with improving posture and preventing further nerve issues. In some cases, medications may be necessary. If the numbness is linked to pain or inflammation, over-the-counter pain relievers like ibuprofen may help. For underlying conditions like diabetes or neuropathy, your doctor might prescribe medication to manage symptoms or control the condition. In more severe cases, prescription treatments may be needed to address nerve-related issues. If a vitamin deficiency, especially a lack of vitamin B12, is identified as the cause, taking nutritional supplements can help support nerve health and reduce numbness. A blood test can determine if you have any deficiencies that might be contributing to the symptoms. Finally, improving the quality of your footwear can also make a big difference. Supported shoes that properly cushion your feet and reduce pressure on the nerves can alleviate discomfort and help prevent further nerve damage. If you spend long hours on your feet, look for shoes with ample arch support and cushioning to reduce strain on your lower body. Regardless of the cause, it's crucial to consult a healthcare provider before starting any treatment. They can help identify the root cause of your numbness and create a personalized treatment plan that addresses your specific needs. So, if you experience persistent foot numbness, it's important to pay attention. Early diagnosis can prevent complications. Consult a healthcare provider to get the right treatment and keep your feet healthy. If you like this video, don't forget to like and subscribe to our channel for more amazing content.